Welcome to another episode of Wellness Chronicles. This is where I turn confusion into clarity. I'm Pooja Patel. I'm a registered nurse and diabetes educator from Toronto, Canada. The purpose of Wellness Chronicles is to help you understand, recognize, manage, and even reverse those diabetes symptoms as easy and understandable as possible, and to be able to support you and encourage you and motivate you through that lifestyle modification to create a happy and healthy lifestyle. I'm excited for you to join us in the fourth episode of Wellness Chronicles. So this episode, I thought I would talk about GI values of foods. So glycemic index, or GI value of a food, is basically a scale, and it's out of 100, and it's a scale that identifies how much and how quickly a food will spike your sugar. That is basically glycemic index, or GI value of a food. So out of 100, the higher the GI value, the higher it is close to 100, the higher the GI value of the food. So for example, sugar and white bread have the highest GI values. Sugar and white bread are allocated a GI value of 100, and that's the highest you can go. So that gives you a good example as to what your reference point is. So there are foods that have no GI value, like for example, celery, spinach, etc. All these things, they don't have any kind of GI value because they don't spike your sugar. Diabetes Canada calls them free foods. So these are also really good for you to incorporate in your body. So low GI value foods are less than 55. Medium GI foods are between 56 and 70. And high GI value foods are 70 to 100. Low GI foods are higher in fiber. Low GI foods are lower in starch. Low GI foods are higher in protein. Basically, they have less carbohydrates, so the glucose spike is much lesser. For example, mixed seed breads, sourdough bread, popcorn, apples, sweet potato, oats, all these different things, they will not spike your sugar as quickly as much. Medium GI foods are grapes, mangoes, a banana that is yellow, kiwi, raisins, these kinds of things. And high GI foods are your processed foods that are starchy. So for example, it would be Rice Krispies, white bread, rice crackers, pretzels, a brown banana, for example. Watermelon is a high GI fruit. So I'm giving you all these examples, and that's great. And you're thinking, do I have to memorize all of these different foods? No, that is not the case. It is important to understand why these glucose spikes happen. So the example that I give my patients is that of a banana. So a green banana that is not ripe is low GI. A yellow banana that is ripe but is yellow is medium GI. And a ripe banana that is brown is high GI because of the amount of glucose it might have. So French fries, for example, mashed potatoes, instant potatoes, those are all high GI foods, whereas a whole boiled potato with the skin is medium GI. So the starch in the food actually makes the food high GI or low GI. So of course, all of these foods, high GI, medium GI, low GI, they're very tasty, they're nutritious, and you want to incorporate as part of your diet. So how is it that you can pick a high GI food and still not be able to spike your sugar? It just means that you have to use some hacks. So for example, cooking your rice, cooling your rice down, and then eating it reduces the GI value of the rice. The same goes with the potato. So if you cool the potato down and then eat it, that has a lower GI than a potato that is hot. Another tip or trick is finding alternatives. So for example, jasmine rice or sticky rice is higher GI value than white or brown rice. So if you're making sushi, maybe try that alternative. Instead of having sushi, maybe have a stir fry with some nori. Choosing alternative flavor profiles will keep you happy and satisfied, and it will satiate those hunger signals that you have actually eaten what you have wanted to eat. Another hack is pairing a high GI food with a low GI or a zero GI food or a free food will help reduce that sugar spike. So it's all about reducing those sugar spikes. So how can you do that? So watermelon, for example, is a high GI fruit. But if you pair that and put that in a salad with some seeds and some nuts, that will automatically bring down that glucose spike that you get post-meal. So 3 hacks I've mentioned so far. Cooling down a hot potato or cooling down your rice will lower the GI value of that food. Third hack is pairing a high GI food with a low GI food for a lower glucose spike. Why is that important? Why is lowering glucose spikes important? Now, the reason why it's important is the higher your peaks and valleys, so your blood sugar goes up, it goes right back down, it goes up and it goes right back down. These peaks and valleys cause diabetes type 2 complications, get you to be really, really tired. So you're always fatigued, tired, you have cravings for food, you're constantly hungry, and it increases your insulin resistance. So you're not helping the diabetes disease process get better by constantly putting your body through that roller coaster of glucose spikes. These glucose spikes will lead to things like retinopathy in your eyes, nephropathy in your kidneys. It will also lead to neuropathy in your feet, so that will lead to foot ulcers and eventually amputations. So you really do want to be very, very careful to prevent those diabetes complications by preventing those glucose spikes, those peaks and valleys. So there was a randomized trial done with patients who chose lower GI foods over higher GI foods. They found significant A1C reductions, significant reduction in insulin resistance, and on top of that, a 75% reduction in increasing medication doses. Those people who chose lower GI value foods over higher GI value foods, they actually were able to maintain the same dose of medication that they had just with their healthy lifestyle behaviors, just by choosing that low GI diet. Even without additional medications, this population were able to maintain good glycemic control and have a significantly lower A1C compared to those who chose higher GI value diet. I quickly want to share with you a story of a patient of mine who's only 30 years old, and she was diagnosed with prediabetes. She had told me when I had first seen her that she had cut out all sugary drinks, processed foods, and she had basically cut out all the desserts, all sugars from her diet. And yet she was still finding that her 2-hour post-meal sugars were anywhere between 9 and 11 millimoles per liter. And her fasting sugars were also a little bit high, where they were between 7.6 to 9 millimoles per liter. So that's a little higher than what we want them to be. Our 2-hour post-meal sugar should be less than 11.1 millimoles, and our fasting blood sugar should be anywhere between 6 and 6.4. That's what you would aim for. So when I did an assessment of her food diary, I was finding that even though she had cut sugar out of her diet, the foods that she was choosing were rather higher in GI value than lower GI value foods. We sat down together and I explained to her what GI value is in a patient who does have diabetes and what that really means. After that, we sat down together and we made a plan together. Because she did lead a hectic lifestyle, we picked one meal. So what we did is together we made a meal plan. So what she used to have for breakfast was white bread with butter and a cup of coffee, and then she would be on her way. Instead, I suggested to her that if she did want to have bread, she consider a lower GI alternative, which would have been a sourdough or a multigrain bread or a rye bread even, whatever she preferred. So she chose sourdough bread. On the sourdough bread, I suggested that she add some kind of a healthy fat. We chose avocados. So mashed avocados on sourdough bread with everything bagel seasoning, a cup of coffee with milk and boiled egg, because she needed to add some protein into that breakfast. So within 2 days, she saw that her fasting sugar was 7 millimoles per liter, and her 2-hour post-meal after breakfast was consistently over the week between 7 to 9, which is perfect. So once she was comfortable managing her breakfast, we added her lunch, her dinner, and her snack. And then in about 3 weeks, we added some exercise. When she did have her follow-up, her A1C had decreased from 7 to 5.7, which is significant. And she only did it by implementing diet and lifestyle change. And she would be able to implement those changes, not just for 1 week, 2 weeks, or even 3 months, sustainably. So for the rest of her life, so she did not encounter any prediabetes in her future. So this brings me to the pro tip of the episode, that small swaps lead to big impact. One small step at a time, one small increment towards a healthy, happy life lead to big impact. So for example, try to pick lower GI foods over higher GI foods. Maybe start with a small snack. If you're having rice cakes with coffee, instead of having only rice cakes with coffee, Maybe add some peanut butter on top. This will decrease the GI value of that rice cake. So from a high GI value, it'll become a medium GI value food. And eventually, maybe try implementing that with your meals also. That way, you're able to sustainably maintain that change over time. We want to avoid behaviors that are not sustainable. So with that, thank you so much for listening to the episode all the way to the end. I really do appreciate it. If you feel like you've taken away any valuable information from this episode, please do not forget to share it and do not forget to subscribe. It's absolutely free and it helps me create more valuable content that is expert and evidence-based for a happier, healthier community. Until next time, please stay happy, healthy, and kind.